My name is Marwan Bukhari and I'm a rheumatologist in the northwest of England, working at the Royal Lancaster Infirmary in the south end of the Lake District. And my interest really is about biomarkers in rheumatoid arthritis. And the reason that I think that they're very interesting and that they're worth looking at, especially at national and international meetings, is that you now have a concept that patients should really have a personalized medicine that you actually use just for this specific type of patient. And the more you know about your patient, the more you can stratify them to give them the treatment. The treatment can therefore be quite powerful and quite effective, but it can also be quite toxic, and knowing which patients you need to give the treatment to is actually quite important. And some of the biomarkers that we have been using have been used for quite a long period of time. We have used in the past rheumatoid factor and CCP as either positive or negative to stratify patients for severity, and maybe features of disease as well to stratify our patients for severe disease. But nowadays we now have much more important markers, including markers that will tell you a bit more about your patient. And an example of this is actually the levels of rheumatoid factor and anti-CCP antibodies. If you stratify patients by these, you can actually then see which patients will actually respond to treatment better. And we know for a fact that drugs, for example, like rituximab and abatacept, will have a better response with higher levels of rheumatoid factor and CCP. On the other hand, you also can look at other types of newer biomarkers. So, for example, you can use the MBDA or the vector chip. And that doesn't just tell you that you do have the disease, it tells you that you will have severe disease. It will tell you that you will need to treat the patient with larger amounts of medication. And you can actually stratify your patient from early on. One of the newer biomarkers currently around is 1433 eta. And 1433 eta is one of the biomarkers that you can now use not just to diagnose the arthritis, but to look at patients who will progress and who will have severe disease. And you can escalate the treatment for these patients quite easily. And I think the future is just going to be us looking at a combination of all of these markers, and they might include genetic markers, single nucleotide polymorphisms, and other ways that we can actually then combine them differently to see which set of patients will respond. Hopefully this will result in us being able to find a chip that you put a drop of blood on, and you'll be able to tell the patient which sort of drug will be suiting them. And I think that will be the future, and we're hoping to see it in my professional lifetime.